Hey, what's up? You're listening to the Less Invasive podcast, a podcast covering minimally invasive surgery and enabling technologies for the operating room and radiology environment. I am your host, Lucien Blondel, co-founder and CTO of Quantum Surgical, a startup commercializing the EPN robot for percutaneous tumor ablation. I bring to the table 20 years of experience in imaging and robotics for orthopedics, neurosurgery, spine surgery, interventional radiology, and interventional oncology. Today, I'm very excited to have on the show Dr. Paula Doyle. Dr. Doyle is a board certified surgeon in obstetrics, gynecology, reconstructive pelvic surgery at the University of Rochester in Rochester, New York. She is also CEO and founder of EndoGlow, a medtech startup commercializing or manufacturing a fluorescent medical device for minimally invasive surgery. And we'll talk about surgery in urology, gynecology, fluorescence-guided surgery, robotics, the EndoGlow story, and of course, the GreenEgg product. Thank you very much, Dr. Doyle, for making time for me today. How are you?
Good. Thank you so much for inviting me. I'm looking forward to this.
Yeah, so let's dive right in the clinical environment. I want to understand and also the audience to know a little bit more about what you do in this space. This is a space, by the way, I'm not very familiar with. I'm more on the bone, spine, cranial side of surgery. So I'm kind of discovering this space right now. And I'm very eager to learn more about that and fluorescence guided surgery. So what kind of pathologies do you treat every day in your practice? What kind of procedures do you perform? And what are the challenges that you face during those procedures?
Sure. I'm probably going to give you an education that you wish you never had because a lot of what I deal with is prolapse in women.
Okay.
I don't know if you know what prolapse is.
Yeah, I've looked at the internet. I know what it is.
But just for the sake of
Yep.
your audience, too, that especially after childbirth, when a woman has a vaginal delivery, believe it or not, the vagina, the uterus can come down and even outside of the body. And a lot of what we do is reconstruct that and put things back up where they're supposed to be or where they originally were. Um, this is a problem that happens to a lot of women. This is not some unique, rare thing. It's just something that we don't talk about that much.
Yeah, I was gonna say nobody is talking about that. I mean, when I'm a happy father of three children, and nobody talked to me about that.
Yes, I think we don't tell women this can happen because they might stop having babies.
Okay.
But so this is a surgery that we do, and one of the most common surgeries we do, especially with minimally invasive surgery, is it's called a sacrocolpopexy. And what we end up doing in the surgery is a hysterectomy. So we remove the uterus. You don't have to remove it all the time, but we usually do. And then we put a piece of mesh on the front and on the back of the vagina, and then use that mesh like a pair of suspenders to just bring everything up. And then we hook that mesh up to a ligament that runs in the spine.
Okay.
And so, because we're dealing with mesh, the dissection has to be really, really good. You don't want the mesh to erode into the bladder or the vagina or something like that. But this is the main type of surgery that we've been doing for prolapse in women.
Okay. So, and what kind of instruments do you use during the surgery? Is it every kind of instrument, scissors, things to coagulate, stuff like that? Do you have to change
Yep.
instruments oftentimes?
So we generally do this minimally invasive. So that means robotic or straight stick. And besides having the trocars and the surgical system, you need to have a manipulator inside the vagina and or the rectum. And what that does is it allows the surgeon to have the organ, that would be the vagina or the rectum, brought up into the surgical field or deviated out of the surgical field. And one of the basic principles of surgery is tension. So there's counter tension that needs to be created, and that can be created with one of these manipulators.
Okay.
You
And
do
and
it.
yeah, and
Go
just
ahead.
for the sake of the audience, what's the manipulator look like? Is it like a jaw or something just to push things up or?
Yeah, so the manipulator, there's a few different types, but generally they're about 12 inches long and they're handheld. And the end of it can be different shapes. So a very common one that is egg shaped, literally egg shaped, where it's 3 centimeters wide, 5 centimeters long. And then that is used to fill out the space that you're operating on, to kind of stretch it
Okay.
out. It's easier to operate on things that are stretched out compared to things that are all bunched up. And then depending on the anatomy that we're looking at, we can change the size of the manipulator to make it occupy more of the space or less of the space, depending.
Okay, and so you mentioned you perform those minimally invasive way. I mean, is it or sometimes laparoscopically through ports in the abdomen, or it's always through natural orifice?
It's through the abdomen and through ports.
Okay, so and you have one assistant that is manipulating this manipulator, or you do this by yourself?
No, when we usually operate robotically, and so the surgeon sits at a robotic console, and then you have somebody at the bedside, at the OR bedside, that has that does assisting, and part
Okay.
of their job is to manipulate either the rectum or the vagina. They do other types of jobs as well, but it's usually the first assist job. Yep.
Okay, and so this person, the first assistant, has to understand where is the manipulator, where are the organs, how is it looking at the screen with the same information that you have in your 3D glasses or 3D display on the robot. Is that correct? So they are looking at
Cor-
a second screen, something like that.
Correct. Yep. They're looking at the monitor that's up in the operating room, and this is how the surgeon is communicating with the first assist, is through the visual of what they can see on the monitor.
Okay, and so I guess when you are operating, you want the manipulator to be moved left or right, up or down, or do something with that. How do you communicate with your team to say, okay, this is not what I want, move it a bit this way or that way? Are you speaking to them right? Or if you are in a console, maybe it's a bit difficult to exchange with the other people.
Communication can be a problem, especially in like a noisy OR.
Okay.
But yeah, you're just speaking directly to the person that's manipulating, and you do your best to be clear in your communication as far as, is it your left, the monitor left, the patient left, like
Okay. Yeah.
whose left are we talking about? And then sometimes you can also use visuals that you see on the screen itself. Like if there's another instrument, you can say, no, move it more towards my other instrument.
Okay.
This is where a consistent OR team can be of benefit, because if it's someone you're used to working with, all those kinks of communications has been worked out. But you know,
Yeah, that's what I.
communication is
Yeah,
important.
that's what I was going to say. You maybe you have your preferred first assistant, because if you are used to work with them for a long time, then they anticipate your needs and they understand what you are saying, and it makes the life easier. But on the other side, I guess there are some challenges in the organization of the OR that. Need to use the personnel they have, and have people change sometimes. So yeah, I understand that. So um, just a quick question. I guess this kind of procedure can be done, I would say freehand, but with your hand laparoscopically or with a robot. Are you doing all the procedures with the robot, or when do you choose to use a robot? If sometimes you do or do not with the robot.
It's usually based on what the surgeon's most comfortable with, what they were trained to do, and what's available at the institution. For me, I'm lucky that I'm at a big academic institution, and we have, I think, 4 or 5 robots.
Wow.
So we can, yeah, so we can have access to it. And I was also trained robotically. I wasn't trained to do straight stick for this, but a lot of people are, but just not me.
So you would rather go likely more robotically. That would be your first choice. Okay, I understand.
Correct.
So now that I understand a little bit more of the pathology, the procedure, it's very specific. I get to understand right now. And it's not about cancer or other kind of pathologies. We'll move on to fluorescence guided surgery. So could you briefly explain to me and to the audience how it works? The conventional way with ICG, what it is, what is it used for? Just
Mhm.
for a basic understanding.
Yeah, sure. So near infrared surgery has been around for a few years now, and all of the major players in the industry, meaning, Stryker, Arthrex, Storz, Intuitive, everybody has got near infrared capabilities. I think we can all agree that if a surgeon can see better, then the surgical outcomes will be better, or the
Yeah.
complications at least will be lower. And part of what industry as a whole has done has made it possible for us to see in other wavelengths. So you know that light is just waves, it's waves of energy, and we can see some of it, and some of it we cannot see. And we cannot see in the near infrared space. But our cameras can. The cameras that we use in surgery can have near infrared capabilities because they have a filter put on their camera that allows us to then see in the near infrared. And the reason why this is important and very good in surgery is the near infrared wavelengths are not absorbed by water. And you know that humans were water, blood is all
Yeah.
water for the most part. So we can now see through this with the near infrared capabilities. And that's why it's been so important to incorporate near infrared technology into the surgical space.
Okay,
I
so
mean,
what you see with near infrared is only tissues. That's what you're saying, and it, magically it makes the blood disappear well in the vision, right?
Not quite, not quite. But you can see through the blood. So
Okay.
you can imagine if you're a surgeon and there's a bloody operative
Yeah.
field, if you could
Yeah.
just see through the blood, how much
Yeah.
that would help you.
Yeah. Yeah. That would, I'm more used to very keyhole surgery, so not that much blood, but I picture this in my head, and definitely that would help. So the fluorescence, how this works? You inject something. There is a
Hmm.
and what kind of things in your practice are you looking at? Is it the, I don't know, some kind of anatomical stuff that are revealed through this technology?
Yeah, so you're right. Currently, the way near infrared technology works is that you have the camera system that we were just talking about, but then you also have to have a fluorophore. So you need something that actually fluoresces.
Okay.
And what people use now is a dye called ICG that's injected into the patient's arm and into their bloodstream, and it goes all over their body. Um, and this is good for things like looking for where the blood flow is, or seeing if there's perfusion to different tissues like the bowel, or if you're doing plastic surgery, you want to make sure you have a robust flap. Also, they use it for lymph nodes. So if someone has endometrial cancer, for example, or cervical cancer, you can inject the ICG and look for the sentinel lymph nodes. I mean, you're in the oncology space, so you know about this. But those are pretty limited circumstances. Right now, you use ICG for an angiography, so just looking for blood flow
Okay.
or looking for lymph nodes. And that's not what I do for the most part. Um, the way that I ended up wanting to incorporate near infrared is I saw all these other surgeons doing it for removing the gallbladder or for lymph nodes. And I'll tell you, surgery is not easy, right? Surgery is just not easy. And
Yeah.
surgery is becoming more difficult as the population gets older. People have more surgeries per person. People are more obese than they used to be. So all these things add up for surgery becoming more difficult. And I wanted to find a way to make it easier. And I thought maybe it was just me that I needed it to be better because I just couldn't see well enough, no matter how good these surgical systems were. But then I started talking to other surgeons, and I'm not alone. Everybody
Mm.
wishes they could see better. And then that's when I started doing research during my fellowship and produced this polymer that can fluoresce under near infrared. Because it does me no good to inject a fluorophore into someone's vein. That's
Mm.
not going to help my surgeries. So I needed to harness that technology and put it to use in a way that's going to help me and other surgeons in general.
So that's how you created the green egg that EndoGlow is manufacturing. So maybe just tell me and the audience how you came up with this idea and how you found some people, or did you invented this polymer yourself?
No, I did not do it myself. Luckily, I work at a university with a lot of really smart people. Yeah, so this was born out of frustration. Frustration. These are really difficult cases. And like I told you before, a lot of times we use mesh. And my job is to peel the bladder off of the underlying connective tissue. And if I make a mistake, and if I get into accidentally damage someone's bladder, then I might have to abort the surgery or at least abort what I was trying to do. And I wanted to see better. That's what it comes down to. I wanted to see better so I could do a better job operating. And I was at a research meeting and I was just expressing this frustration I was having because I was late to the meeting because a case was really long and really difficult. And the people at the table were like, we could do something about that. We could come up with a way that you could see better and not have to change anything about your surgery. Right?
Oh,
Because surgeons,
yeah.
you're an
They don't want.
engineer. You
Yeah,
don't
yeah. They don't want to change.
no, you don't want to change. You want to do exactly what you've been doing, but you just want it
Yeah.
to be better somehow. And that's when we started going through the process of all this research and coming up with a way that we could make surgical instruments not just passive, but
Hmm.
actually active and help us see better. And that's when we came up with many iterations, of course, of the polymer. But yeah, so we came up with a plastic that is fluorescent and can really be used with the near infrared capabilities.
So what it
So we
means
can
is
see
is
better.
you just insert this egg-like. I mean, the distal part is like an egg manipulator, and when you turn on the near-infrared imaging on either your laparoscope or your robot, then it glows. It fluoresces, right?
Yeah,
Okay.
you are correct. And I mean, it sounds really simple because in a way it is, but we did a few studies that gave us results we didn't expect. So the first time we did a cadaver study because we just wanted to see, does this thing work? Like
Hmm.
does it glow if you stick it in an orifice? And we found that it does work. And then, okay, great, this is good. Then we went through the steps to get it into the operating room and do it in a real clinical setting with real surgery. And that's where we made some discoveries that we didn't expect. So we expected it to glow, right? Because we did the cadaver study. But we did not expect to be able to see other things. Like you can see the scarring underneath the surface. And remember, we were saying how near infrared can go below the surface, like you
Yeah.
can see through tissue. So, for the first time when we were operating, you could turn the near infrared on and all of a sudden see the quality of the tissue that you were looking at because you could see the strands of scarring, for example. We could also see subsurface pathology. There was one case where we had the manipulator in the rectum and we could see endometriosis that was deep. So the reason why that's important is because when we were operating in the visible light spectrum, just with our naked eyes, everything looked completely normal. It looked
Hmm.
just fine. And then as soon as we turned the near infrared on with our manipulator in the rectum, we could see that underneath the surface, there was pathology. We couldn't tell you at that moment that it was endometriosis, but we could just tell you it wasn't like the surrounding tissue. So that was something cool that we ended up figuring out during that clinical study. We also were talking about communication. You and I were talking about communication
Yeah.
earlier. Well, the communication improved, which was completely unexpected. But there was surgical assists or surgical learners that said, for the first time, I know what you were talking about.
Yeah. Okay, I understand
like
that.
I
Yeah.
like they could see the surgical planes maybe or the margins better, and it improved communication, which was also unexpected.
That's
Oh,
great.
It
Yeah.
is. Let me tell you one other
Yeah.
unexpected
Go
thing.
ahead.
This goes mainly for robotic surgery.
Hmm.
So I don't know how familiar your audience is with robotic surgery, but it's like operating in a video game. Your
Yeah.
optics are really good, but you can't feel anything. There's no
There is no tactile
haptics.
feedback. Yeah.
Right. There's no haptics. And so with the fluorescence, it gave the surgeon the impression of relative tissue depth
Mm.
because you could tell where it was really fluorescent, the tissue must be very thin. And then in areas where it wasn't as fluorescent, you knew that the tissue was really thick. So it gave this like pseudo haptic
Hmm.
experience because of the relative tissue depth that was
Yeah, yeah,
exposed.
that's very interesting because I've been in the surgical robotics world for 20 years, and actually I started on a research project for a laparoscopic teleoperated robot similar to the Da Vinci system. The system never came out to the market. It was more a research project, but that gave me a little exposure to endoscopic surgery. But since then, I've always heard about. I moved on then to orthopedics and neurosurgery. But since then, I always heard people complaining about we miss the tactile feedback, we miss this haptic feedback, the feeling of the tissue, and yeah, it's very interesting that somehow you found kind of a solution, an alternative to having this embedded into the robot, but bringing this information to the surgeon through visual indication with the fluorescence and near infrared imaging. That's, I mean, that's very interesting. So does this mean that those unexpected benefits of fluorescence were not provided by conventional ICG injection for in other cases? So that's something new that came out of using this device, the GreenEgg device, with a manipulator into the body, right?
Yeah, yeah, correct. Because if you think about ICG, it's in the blood and it
Yeah.
just flows and it goes everywhere.
Hmm.
And what we've been able to do is avoid that and just concentrate the fluorescence where we want it or
It's
where we
it's
need it.
it's like a targeted fluorescence. Instead
Right.
of having a systemic treatment, you just put something where you need it to, and not everywhere in the body.
Right. Yeah, exactly. And with with our lead product, it's a little bit selfish, but I wanted that specific manipulator and that's why we ended up making that.
Okay, and so I understand the benefits of the technology, this polymer. I understand that you first design a product that is for your needs around reconstructive pelvic surgery, and maybe that can be used for other type of procedures. Can you make? Do you have plans to make other devices to for other surgeons that face? You said that everybody is facing the same issues. Is it something that you could uh, implement into other passive instruments to make them active, as you say?
Yeah, absolutely. And this is the really exciting part too, because I talk to other surgeons and, I'm a pelvic surgeon, but like you, I'm always looking to learn about what other people are doing.
Hmm.
And so I talk to all different types of surgeons, and then they're giving me ideas about something they would like that fluoresces. I
That's
must have
great.
been given 50 different ideas of what somebody wants me to make.
Okay, so it's just the very beginning with the green egg is just the very beginning of bringing fluorescence into instruments that are used in minimally invasive surgery. So I understand there is no other similar devices on the market right now.
No, not like this. There are not. There are some. Let's see. Stryker makes the iris stents. Those are that go in the ureter, but those are not fluorescent like ours. They have to actually be plugged in, and then it has a light, and then you can see the light
Oh, it's a
through
powered
the near
system.
infrared. It's powered, and
Okay.
I really didn't want to go down that route because there's always problems with finding a place to plug things in, and is there enough
Yeah.
outlets? Is it a tripping hazard? I didn't want to get into all that. I wanted to do everything surgically the way I've always done it, but just make it better. And
Mm-mm.
that's why ours is It's not powered. You don't have to plug it in. You don't have to turn it on. It's just the inherent property of the plastic itself.
So basically, and the surgeon is happy about that, you do not change anything. You just replace one manipulator by one another that is the similar shape. It's just the plastic that is different. It's not, as you say, stainless steel or other material. And other than that, it doesn't change anything to the practice, right?
Right, except to make it easier for you to see.
Yeah, I see better. Yeah, I got that this one. So is the green egg commercially available right now on the market, or if not, when can I buy it?
So it is not commercially available yet. We are in the last phases of FDA testing, and we hope to have it commercially available the first quarter of 2023. So by spring of 2023, it can be commercially available in the United States.
Okay, so you have obviously I understand you're quite a small team, and that's impressive. All what you've done. We saw a few people, and so you are targeting first the U.S. market, which I understand, and then you will see later bringing it to France or Europe or Middle East,
Yes.
Africa, Asia, stuff like that.
Yeah,
Okay.
absolutely. Absolutely. Yeah, we're a small team. There's 5 of us.
Wow.
We've all invested in the company and we all work every single day at the company to make things go forward. And our plan is to launch in the United States. We've been co-marketing with some large industry partners at different trade shows and really just trying to get as much exposure as we can.
Yeah.
And then our patent did get granted in Europe, so we're coming your way.
Ah,
We will be
congrats.
there. But we just need some time and some partners. I mean, to be quite honest with you,
Yeah.
like I said, we are a small team, and I feel confident that we can get sales in the United States.
Hmm.
But branching out, we're going to need partnerships
Yeah.
for, because I don't think that at this current moment we could do it without partnering with larger industry members.
Yeah. Otherwise, you would have to raise a lot of funds to structure the company to be able to do that by yourself, and maybe that's not the way you want to go, or maybe we'll see. We'll see in the future. All right, so we've learned about your practice, fluorescence-guided surgery, this green egg device. Let's just talk a little bit more about the company and the progress that you've made. So you've been founded in 2017, right? Pretty much exactly the same year as Quantum Surgical. So what retrospectively, what has been the main challenges that you and the team faced starting, launching, growing the company, and developing the product during those 5 years?
Yeah. That seems like a big question because we've learned so much. I think all of us have. Um, so, one thing that has been very important is staying focused. You know how
Yeah,
earlier we were talking about this plastic can be made into
yeah,
anything, and we've got 50 good ideas.
yeah,
So, really just focusing on the lead product, focusing on getting it to market, the early adopters getting the market used to using these devices before we start going off on our next project, our next project, our next project. So I get really excited about this, and I do want 100 different products. So staying focused with our energy and with our resources has been a challenge that we are achieving, but it's something we always have to remind ourselves about. That's for sure.
yeah. I mean
Um,
that resonates very much with our own story at Quantum Surgical. We do a robotic technology that helps interventional radiologists insert a needle percutaneously into the body to destroy tumors, basically based on CT images. And these kind of procedures, they happen in the whole body. I mean, it can be not the whole body, but almost. And what we chose is to say very much focused. We say, okay, the same technology could be applied to a great variety of organs, including the bones. But we will start with liver because there is a great need there, and we'll start with ablation, and we will learn the clinical environment, the indication, how it works, what they need for liver ablation. we'll market this product, and then we will expand to other organs, which we are doing right now with kidney, and then later other organs. But definitely, this is the one advice I would give to anyone, to stay focused like you did, because otherwise it's very difficult with a small team to address all the challenges.
Good. I'm glad you have also experienced that. But yeah, staying focused, um,
And how did you
it's
do?
serving us.
So you said you are 5 people. You created the team, or people approach you to join? How this very small but effective team was created?
Yeah.
That's very interesting. A lot of people, they say, okay, maybe I would like to be an entrepreneur, but I don't know. I'm alone. I will not be able to do it. So I need a team. How I find the people that will help me um, craft the vision and execute on the mission.
So the way it happened with me is I told you that I made this polymer, or we made this polymer, we being me and some PhDs at the university, and we filed a patent through the University of Rochester. And once the patent is going through, the university then approached me and said, "Do you want to license this back? Because you have the right of first refusal, or can we go license it to other companies?" And that's when I was like, wow, I have to make the decision if
Yeah.
I'm going to start my own company or let them go license it to other people. And then that's when I decided that I'm going to make a company. And I had never even thought about that before. It never occurred to me because I'm a physician.
Mhm.
And once that happened, I realized that I needed help. I know what I'm good at, and I know
Yeah.
what I am not that good at. And so I joined an incubator, like a business
Okay.
incubator, and I got a crash course in business 101 on Wednesday nights, trying to learn all of everything I could. And through them, I got introduced to two gentlemen that had had a medical startup in a town just over from Rochester. And they grew it for 14 years and sold it
Mhm.
and retired. And
Okay.
they realized that they were a little too young to fully retire and they wanted another project.
Mm.
And that's when they ended up hooking up with me.
Okay.
Um, so then there was three of us. And from there, they brought in another one of their friends with some more expertise in a different area. And then we just recently, our most recent team member was sales. We have a national sales manager now with a lot of experience in, medical sales. She owns her own distribution company. But that's how it really started, was an ultimatum from the university that either I started it or they licensed to someone else. And then bringing in people that have experience being a CEO, being business development, being operations engineers, things like that.
That's a great story. I think I've never heard this kind of story of this ultimatum. I mean, it makes a lot of sense for the university, but I guess it was kind of surprising for you to say, okay, I need to take a decision. I haven't even, thought about that before, but now I need to take the decision. What triggered you to say, okay, I will start my own company? What was the forcing factor? What were you looking for?
Um, this might not say good things about me, but it was the control aspect, quite honestly.
Okay. Yeah, you wanted to control what you've created, basically, or invented in some way. You wanted to bring it to the market in the way that would be relevant for the surgeon, and not having something that would go in a direction that you, at the end, as a end user and physician, would say, okay, no, that's not exactly what I meant. Is that something like
Yeah,
that?
yeah, absolutely. Because I knew how much it helped me. Even
Hmm.
just in the small trials that we did, I knew how much it helped me. So 100% confident, 100% confident in our devices. But I was afraid that they were going to license it to one of the big industry players and then they were going to just hide it away for 30 years.
Yeah, yeah, I understand that. I mean, yeah, there is always a risk, and you didn't want to take this one, so that's, I mean, that's great. So right now you're both, you're still practicing a couple of days a week, I guess, and leading this company as a surgeon, and having discovered business and all things, I guess, related to quality, regulatory, product development, marketing, sales, stuff like that. how do you manage to do you have reserved days where you work on the companies, and then the other days you are a normal surgeon? How do you combine those both activities?
Yeah. Uh, I really need to thank my university because they recognize that I'm doing this other work. And so now I am part time clinically. So half of the month I work clinically, operating, seeing patients in clinic. And then the other half of the month I'm working at EndoGlow.
Okay, so I guess what I understand is that you brought into the team seasoned expert, medical technology experts, so that you could. That was really helpful for you, given your profile, a first-time entrepreneur, surgeon, to really rely on them to execute or make all what you had to do. The team had to do to make this project moving forward, and having those two people, two and then two, three, four people, very experienced, was a key factor in the success of the Underglow story until now, I guess.
Yeah, it's still, I think, the key. Everybody has acted like a mentor, I think, for each other. They've
Mm.
taught me a lot of things, I've taught them things, but yeah, they've definitely been a mentor. And, when you're starting out, we weren't just making a product, we had to also make a company at the same
Hmm.
time,
Yeah,
which
yeah, I know
is
that.
challenging. So
Yeah.
I mean, our team is the best. It couldn't have happened without them. That's absolutely sure.
So it's all the people are located in Rochester or around the area, or is it like a reboot?
Northeastern United States.
Okay,
Yeah.
all right. Thanks. I mean, that's yeah, it's a very interesting story of a medtech startup. I mean, it's quite unusual to have a medtech startup that is woman-led, that is founded by a surgeon for a surgeon, and I personally think it's really a great way to make sure that the product really answers a physician's needs, because we created the company. We're all engineers, and of course we discussed a lot with physicians, maybe 40, 50 physicians the first couple of years. But having someone that is the founder of the company and that already knows all about the clinical environment, the needs, and being capable of testing and validating and giving feedback to the product development, that definitely is something I recommend for anybody who wanted to start this kind of a company. All right, so maybe just a last question about a bit more personal. So I guess you are very busy. I understand you are part time, but still you have everything in your mind, both your patients, your practice. What I guess you have to learn also, keep learning about minimal invasive surgery, robotics, stuff like that, and the business on the other side, and all the challenges and all the stuff that have to be done. What do you enjoy doing outside of work to just get a little bit more free of this stress?
Yes. So you're right. I work a lot. I definitely work a lot. To help keep my mind sane, I run. I run and I swim. That's what I do. I run and I swim. And I just discovered a new sport.
Hmm.
Maybe you're familiar with it because you're European. It's more of a European sport. It's like run swim.
What is that? Is it a triathlon? Or no, is it different?
No,
Okay.
no bike, but you it's more Scandinavian maybe, but you run, you
Oh,
swim, you run, you swim, you run, you swim. So you're
okay.
swimming in your sneakers and you're running in your wetsuit. You've heard
Okay,
of this.
okay, okay. Yeah, that sounds a little bit crazy, but that must be fun. Yeah, I think so. Yeah, oftentimes people use sport to do this. And is it? So I guess this activity is mostly outdoors. When you swim, is it in a swimming pool or is it in a river or a lake or the sea? I don't know. I'm not sure where is
Yeah,
this
yeah.
here.
So maybe you don't know, but Rochester's very cold. We
Oh no,
got
I don't know.
about Yeah,
Okay.
we got a lot of snow last night, just to let you know.
Oh, okay. It's not the
um,
weather we have right here right now.
No, we're not in the south of France.
Okay.
But so, yeah, I swim in a pool most of the year. And then for about 4 months in the summer, it's really warm. And I live on a lake and I live, in a lake. area.
Okay.
So then it's outdoor swimming in the lakes in the summer, which is really, really beautiful. I enjoy that a lot. And then as far as running goes, I usually run in nature as well, just
Okay.
run in the trails and stuff.
All right. I need to look at some picture of Rochester's to understand what's the landscape over there. All right. Thank you very much. I've asked all my questions. I know I have a much better understanding, even if we talked offline about your product and your practice. Now I really get it, what it is used for, what's how it fluoresces, and what kind of pelvic practice you have. That is, I understand, very specific. So it's your turn. If you have a question you want to ask me, feel free to do so.
Okay, good. I have a few questions for you. At Quantum Surgical, do you guys use near infrared? Do you incorporate that?
That's a good question. Actually, we are not into the surgical space. So we are in an interventional radiology that is performed in a CT room, interventional CT room. So we do not. I mean, I say we, but the physician is not opening the patient, and we do not use endoscopes. So there is no visible light cameras that is used during the procedures. It's only based on X-ray images when it's a CT, or ultrasound images when it's ultrasound guided procedure. So I get this question sometimes, but we do not have this kind of visible light or near infrared imaging. But surgeons who practice liver surgery, they do a lot of stuff, and including robotically or laparoscopically procedures, and I guess they're using this kind of techniques.
And then okay, yeah, because it's all CT guided
Yep.
what you're doing.
Yeah.
Okay, okay, good. The other question I had for you was, why did you start a podcast? I mean, you have all this work going on. You're an engineer, and then you decided to start a podcast too.
Yeah. I still ask myself this question. No, I love it. I mean, I was two things. I think communicating about your work is almost half of the story of being successful, because you can do a great job. If nobody hears about your story, then you're not finding the success. So being able to communicate like you do with your product is a good part of making sure that your product is getting into the hand of physicians. In the end, they will treat patients. So, and I do this product for the patient, not for something else. So this is one reason, and the other reason is I truly believe that there are a lot of silos. I've seen this in all the various specialties I've worked for, in orthopedics, neurosurgery, spine surgery, in surgery, but I guess in other industries as well. There are silos, and technology is not for a specific indication. I mean, there are specificities, but basically a robot is a robot. A planning software is a planning software, and near infrared imaging is near infrared imaging, whatever specialty you will use it. So we need to yeah, the goal is to bridge the gaps between physicians and industry, between industries and between physicians, because I really believe that we can share some stuff that will help others, and that will raise the tide for everybody to bring more innovation and bring more meaningful innovation. So it's kind of difficult to talk to surgeons, because you are very busy, you have a schedule, and you have a lot of requests from salespeople and other companies. And so, I mean, the podcast is a way to have a conversation with the end user, understand the needs, and really bridge this gap. And basically, I've been invited. The story is I've been invited to a couple of podcasts before I thought about that, and I really enjoyed listening to discussions between people, you or me, or uh, CEOs and VCs and surgeons, and you learn a lot, because it's like you are at a seat at the table, and you just listen to two people discussing, and you can learn a lot. So I say, okay, if I learn a lot from this podcast, maybe I can provide something by discussing with someone else. So that's how I started. And I say, okay, let's try.
That's a very nice answer.
All right. Thank you very much, Dr. Doyle. We've done those 45 minutes. That's very nice of you to have made the time for me. I'm very grateful to have have had this discussion. How can people reach out to EndoGlow or yourself to know more about the product, the GreenEgg system?
Sure. I would recommend going to our website. So it's EndoGlow, EndoGlow.com. You
All
can
right.
find us there.
All
Thank you
right.
so much. It was great to spend time with you.
All right. Thank you. Remain on the platform. I will stop the discussion and thank you everyone for listening to this episode of the Less Invasive podcast.